the population is aging and osteoarthritis tends to affect older adults more, so understandably rates are going up. The population is also growing in girth, so as we get larger and larger, the pressure on the knee joints gets greater. So that's the increase in obesity is actually another reason for the increase in rates of osteoarthritis. So it's becoming, well, it already is, but it's becoming a major public health issue. There's a lot of research going on in the knee osteoarthritis field. There's important work to understand the pathophysiology of the disease itself. That is, what's going on in the knee, for example, that's driving changes in the joint and so on and so forth. And then work like ours and many others where we're trying to understand above and beyond what's going on in the knee, what other factors are contributing to pain and disability in this condition. And we look in particular at how the way the brain processes pain may be changing in people with knee osteoarthritis. Historically, knee osteoarthritis has been considered a peripheral regional pain condition whose pain and disability are driven largely by the changes that are going on in the knee joint. And that causes stress on the knee joint and some inflammation, and that turns on pain fibers in the knee, and that produces pain, right? And all of that is important, and there certainly are peripheral factors that influence knee osteoarthritis. And then we also focus on the central nervous system factors. That is, what's happening once the pain signal reaches the central nervous system, either the spinal cord or the brain or both, and what kind of changes happen in knee osteoarthritis. And there's increasing evidence that at least a fair proportion of people with knee osteoarthritis seem to display central sensitization. That is, their central nervous system has gotten much better at experiencing pain, and they respond more robustly to pain input. That can be due to changes in the spinal cord, but also changes in the brain. And there's now evidence that certain areas of the brain shrink in people with knee osteoarthritis. So there's some brain atrophy, essentially, that's attributed to the chronic pain of knee osteoarthritis, and that when you successfully treat the knee pain, the brain grows back to its normal size to some degree. And so we're trying to understand more about what are these factors that cause changes in the way the central nervous system processes pain, and how can we address those factors in treatment. It's not necessarily inevitable. It's very common, and if we live long enough, many of us are at risk for experiencing osteoarthritis, but there are things you can do to reduce your risk. Probably the primary thing would be maintain a healthy body weight, because increased obesity is one of the major risk factors. Trauma is another risk factor. So injuries that people may have had even in their earlier years, sports injuries and other injuries to the knee, can put people at risk for development of osteoarthritis later in life. There are certainly likely some genetic risk factors for developing osteoarthritis, but maintaining a healthy weight and maintaining an active lifestyle, a level of physical activity, are two ways to help combat the inevitability of knee osteoarthritis. And there is evidence that African Americans in particular, and maybe other minority groups in our country, are at risk for higher levels of pain and disability when they develop knee OA. It's not necessarily that rates of knee OA are particularly higher in any ethnic group. It's that when knee OA is present, African Americans, which is the group that we study, experience higher levels of pain, they experience more disability, functional decline, and we're trying to understand the factors that contribute to those ethnic differences in pain.